Today, we're tackling a pretty massive topic, building those huge EHR systems. I'm talking province-wide or even national scale. Millions of patient records, the whole shebang.
Oh, yeah, this is the big leagues.
We've got this awesome source, 10 practical lessons learned for EHR professionals, and it's like straight from the trenches. People who've actually built these systems.
You know what strikes me about this? It's not just the tech stuff.
Right.
It's the people side of things.
Oh, absolutely.
You're basically reshaping how healthcare works from the ground up.
See, that's what I always get stuck on. Where do you even start?
Yeah.
You know, it's such a massive undertaking.
Well, you got to start with the foundation, right?
Okay.
Interoperability.
Yeah.
Imagine if every hospital, every clinic, every lab all spoke different languages.
Oh, gosh.
Total chaos. So interoperability, it's about making sure all these different systems can talk to each other, share information smoothly.
Okay. So it's like a universal translator for healthcare data.
Yeah, exactly. And that's where the technical nitty-gritty comes in HL7, FHIR, IHE profiles.
All right. So I know those are industry standards.
Yeah.
But what are they actually doing?
Think of them as the rules of the road.
Okay.
Making sure everyone's data is formatted in a way that any system can understand.
So a doctor in, say, Toronto could instantly pull up a patient's record from Vancouver.
That's the idea.
Yeah.
Life-saving stuff right there. And here's the kicker. Getting all those systems to play nice isn't just about the tech.
Oh, I bet it's not.
You need everyone on board. Doctors, nurses, admins, the IT folks, everyone.
You know, this reminds me of this story. I can't remember where I heard it, but it was about a new EHR system they rolled out.
Uh-oh.
And they didn't really consult the nurses.
Oh, no.
You know, the folks actually using it every day. And it created so many problems.
Classic example right there. Stakeholder collaboration is essential. Absolutely essential. If you don't involve the people who are going to be using the system day in and day out, you're asking for trouble. It has to fit into their workflows.
Right, not the other way around.
Exactly.
It's like designing a car without ever talking to a driver. You might get something that looks fancy, but good luck driving it.
Couldn't have said it better myself. All right, let's switch gears for a second. Talk about something super important. Data privacy and security.
Oh, yes. That's a big one.
Huge. You're dealing with incredibly sensitive information, people's medical histories. Trust is everything.
I'll admit, this is where I always get nervous.
Rightfully so.
You've got all this data flying around between systems. How do you make sure it doesn't fall into the wrong hands?
Think of it like a bank vault for medical records.
Okay.
You need layers of protection, access controls, consent management, audit trails, you name it. All to make sure only authorized people can see the data.
Okay, that makes me feel a little bit better. But even with like Fort Knox level security, wouldn't it get confusing if different hospitals use different terms for the same thing?
Oh, 100%. That's where standardized terminology comes in. These codes, they make sure everyone's speaking the same language, like a medical dictionary that everyone agrees on.
That makes sense.
Prevents miscommunications, errors, all that.
Okay, but let's be real for a second. What about all that old patient data, the stuff that's been sitting in paper files or outdated systems? How do you even begin to move that into a shiny new EHR?
Data migration, that's a beast. It's like moving out of a house you've lived in for decades.
Yeah.
You got to sort through everything, decide what you keep, what you toss, how to organize it in your new place.
I bet there are some real surprises lurking in those old files.
Yeah.
Like digital archaeology almost.
Oh, you have no idea. It's a journey, that's for sure. All right, so you've got your data.
Yeah.
Now you hit another challenge, customization versus scalability. You want a system that fits your specific needs right. But go too crazy with the customization, and it becomes a nightmare to maintain and update, especially when you're talking about a whole province or a country.
It's like building with Legos. A little creativity is fun, but if you use too many weird one-off pieces, good luck expanding or changing it later.
Perfect analogy. You got to find that balance. Flexibility on one hand, standardization on the other, and then, of course, you got to teach everyone.
Training. That's got to be huge.
Absolutely massive, but you can't just have one generic training program.
Right.
Doctors need different things than admins, than nurses, than everyone. It needs to be tailored, hands-on, practical stuff.
And you know what else is important?
What's that?
Patience. Change is hard. People get used to doing things a certain way, and suddenly there's this new system. It's a big adjustment.
Change management, that's the key phrase. You need to communicate clearly, address people's concerns, and celebrate the wins along the way. It's not a sprint, it's a marathon.
Totally agree. But once you get over that hump, I mean, the possibilities are pretty amazing, right? All that data at your fingertips.
That's where things get really exciting. We're talking population health management, reporting, predictive analytics. Imagine using data to make healthcare better for a whole community.
So it's not just about keeping records anymore. It's about using them to make healthcare smarter, more efficient.
That's the ultimate goal.
Wow. Okay, so to wrap this all up, if there's one thing to take away from this whole deep dive,
Yeah.
building a successful EHR system, it's about so much more than just the tech. It's about people, processes, working together, thinking long-term.
It's about making a system that truly serves the needs of both patients and healthcare providers.
Couldn't have said it better. Well, folks, that's our deep dive for today. Keep exploring the world of EHRs. The future of healthcare, it's in your hands.
Until next time.
See you all then.